Welcome to Life Esteem.
Hello, welcome again to Life Esteem. Always great to have you as a viewer, Pat and I, and
Yes.
we're so glad to have with us in the studio my colleague, Susan McCoolidge, and she's Director of Allocations and also Agency Relations there at the United Way at the Capital Region. So glad to have you, Susan.
Yes,
Thank you.
Yes, indeed. Susan, you have a lot going on at the United Way. Tell us all about some of the programs and things you're working on.
Okay, probably the biggest effort that I've got going on right now is around adolescent and children's mental health. And that's a priority that our United Way recognized several years ago. And the first thing we did was we went out and started trying to fund some programs around that to expand the capacity. And then over the past year, what we've started is a series of 4 workshops that are aimed at parents, adolescents with mental health issues, and professionals in the area dealing with that, trying to bring them together, provide some education, support, and so forth. It's an issue that I myself personally am extremely passionate about, and I'm very happy to bring this out to the community.
Fantastic, yeah.
Now, I understand that there's possibly some proposed budget cuts in this area.
There are some huge budget cuts that are being proposed in this area. And both as someone who works with human service organizations that deal with kids and adults with mental illness, as well as a grandmother of a child who has a severe mental illness, it's very frightening to me personally what's going to happen to people if the services are so drastically curtailed, and I don't see how they can't be with the level of cuts that are being proposed.
Yeah, that is a very good point. It's frightening. But in your capacity, though, you're, like you said, you're doing the workshops. You actually hit up a FCC, what we call a Focused Care Council. Talk a little bit about that as well.
I actually am staffing the Focused Care Council for Health now. We just changed the name. And in that Focused Care Council, we bring together some community experts, some organization staff, as well as some interested volunteers, and bring them in to talk about what they see as the issues that are affecting our community around health. And also a large priority for us over the past few years has been the issue of access to health care. We really have to recognize that with the cost of health care, with the rising costs in insurance, as well as unemployment rates, there are a lot of people out there who can't afford health care, don't have insurance, or in some cases can't even afford the employee copay to purchase any type of health insurance. So we've been working really hard, and over the past few years have been able to fund another number of programs that can help meet that need for individuals. We recently, over the past year and a half, admitted a new program called Hope Within Community Health Center. They sit on the Elizabethtown and Middletown border and serve both Lancaster and Dauphin County patients. And they are a free clinic, more or less. And what they do is they serve individuals who fall within their income criteria and who have no insurance whatsoever. And when those individuals are able to attain insurance, or when they qualify for it, then they will not see that patient anymore, and that's how they keep things fluid and are able to keep it moving. We're also providing funding to the Mission of Mercy mobile clinic that comes into Harrisburg, I think once or twice a month, as well as some other organizations. We recently provided a grant to Sadler Health Center for West Shore clients and so forth. So we're very happy to be able to help individuals in this area to be better able to access some health care.
Well, you know, it's interesting you bring this up, because one of the things so often that I recognize that people truly don't appreciate when we talk about disabilities, mental health is a disability.
Absolutely.
And it's not some instances given the same attention and the same opportunities as people with physical disabilities. Did you see that?
You're exactly right. One of the things that at our workshop last night was talked about, we had a psychiatrist in from Hershey Med Center, Lynn Taylor. And one of the things that she was talking about is the fact that in a lot of cases, mental health, even insurance, doesn't get the same level of benefit as other things too. There's limits on mental health visits, Sometimes there are some companies that perhaps might have a different level of copay for mental health services and so forth. So it's treated somewhat differently. And I think that's extremely, extremely problematic, and especially in this day and age. Because the really sad thing is, with everything that's going on, there's such an increase in need for mental health services, regardless of what your age is. We see it from one end to the other. Senior citizens are having more and more mental health issues. And I think a lot of times it's been extremely easy for us to sweep those issues under the rug, saying, oh, you know, they're older, it's Alzheimer's, it's dementia, and not really dealing with the fact that an individual, as they age, shouldn't be depressed. They shouldn't fall into this. But at the same time, they're entering an age when there's a lot of loss that's going on, changes in their lives like retirement and so forth. So they're really struggling a lot of times. And that's also an area where there is a real lack of capacity when it comes to specialists in geriatric mental health. So that's an issue that we have. And then on the other end, we have the children's and adolescent. And we also have an issue with access to psychiatric care for those children, long waiting lists and that type of thing.
Yeah, it's interesting you brought that up, because I was just doing a session with some child welfare professionals, and they talk about the challenges they face in getting scheduled appointments for mental health.
Absolutely.
And it could be anywhere from 3 to 6 or 8 months out. And when that family individual needs something done immediately now, and you know, how do you address that? I mean, what is it? I mean,
well, a lot of times those families wind up in crisis. If you can't get the care and the issue continues to escalate, then you have the problem of something happening at the home. Mom, dad, the caregiver, sometimes grandma or grandpa have to actually call crisis intervention in. Now, what happens then sometimes is the child winds up in an emergency room, and that's how they wind up accessing services. That's not the ideal way to do it, obviously. But again, it's a capacity issue. We don't have enough child psychiatrists. Interestingly, one of the things that I've been watching, and again as a grandmother, when I first started going to various hospitals, because my granddaughter's been in and out of care for many years now, when I first started going in to see her, you would see the other kids there, and you knew there were issues, that there were problems. Over the last year or two, when I've gone to visit her, what I've seen is kids who are in so much pain and so much stress. It's a completely different world and almost seems to be escalating. If I sit back and I remember when I was a kid, way back when, our parents used to say to us, you know, when you had a problem, it'll be better by the time you get married, you know, or, you know, little Johnny's just got a case of the blues, he'll be okay. And a lot of times that was the way it went. But what we're seeing now is kids aren't throwing things off the way they used to for whatever reason. And that, I think, is one of the sadder things. We also start to wonder, okay, what is it? Are there more children now than ever who have mental health and mental illness issues? Or is it that we've become better at diagnosing it? And I'm not quite sure. But what I can say is, when I was in school, I don't remember seeing as much of it as what we see now.
Oh, absolutely.
I agree with that.
Yeah,
I mean,
so do I.
Very rarely, in most instances. I mean, you just didn't have any understanding, I think. And